Minister, if you could speak to if there are 6,000 to 7,000 rare diseases recognized in Canada, are the 4 elected drugs off the national common list the only ones included under this agreement, or will diseases not treatable by these 4 drugs will they expect help with their treatments as well?
Thank you very much. It's just the start. These 4 that are identified today are expensive drugs that we will be able to use very soon. But there's lots of others there that will demand similar attention. We will continue to work towards covering all of these drugs. They are approved by a joint committee, a joint group that works with our province and the federal government. And we're very much looking forward to many more drugs for rare diseases being covered. It's just a start.
Thank you. And I understand that the National Rare Disease Drug Strategy was put in place, but I understand that the Canadian Organization for Rare Diseases has been calling for around a decade, including another letter published yesterday, for a national rare disease strategy not specific to drugs. Is there a reason that the strategy implemented was one specific to a few common drugs as opposed to that overarching strategy?
Well, as I said, change is iterative, a step at a time. And I think one of the things that's hardest as health minister is to go and see the incredible needs that exist within the system. And I think part of the reason that we're not seeing change fast enough is because there's often this binary question of, do nothing or do it all. And so as a result, we end up in this kind of purgatory state where things get frozen. And so the approach that I've tried to take over the last year and a half as health minister is, frankly, to hold the pain of going in and meeting with people who deserve help and aren't getting it yet, and accept that the only way that we get to the health system that we deserve is one step at a time. So, that is, you can imagine, I was just in Alberta. We had trilateral meetings with First Nations leaders there, hearing devastating and very painful things in those communities. And incrementalism doesn't sound all that exciting when you're really dealing with the challenges there. And it's the same thing on rare diseases because, as John just said, this is an important step, but it's a step, it's not the full journey. But this is how we get it done, in my estimation, is we build one step at a time. And I think by having evaluation and really building that science and the data around those decisions, then we can demonstrate to Canadians that not only does this improve health outcomes, but it saves money and it makes the next steps easier. And frankly, that's how our health system has been built. It's been built sort of one step at a time in this way. I like to call it radical incrementalism.
There are no legislative safeguards.
Well, you can say that.
Well, you haven't cited one. You haven't cited any. You haven't cited any, and you haven't responded to the fact that 78% of Ontario psychiatrists believe that whatever so-called safeguards that will be in place are completely insufficient. We're talking about wrongful deaths when there's an inappropriate application of MAID. That's what we're talking about.
So we're talking here
what
and
we're
see...
talking
here and see in this
about,
legislation
Minister, is what you've demonstrated is that
we're taking
ideological.
First of all, I'm just going to say I reject.
You're playing with people's lives.
I reject that totally. I reject
that. Absolutely disgraceful.
No, what is disgraceful is mischaracterizing my position or mischaracterizing the position of any member of Parliament, sir. Saying that any member of Parliament doesn't care about any human life is a disgraceful thing that I will not tolerate.
Well,
and for you to step into this committee and make an accusation of any member of Parliament that they do not care about the life of another human being is absolutely beyond reproach, sir. I have spent my entire life, as you have, fighting for the good in this world. And for you to accuse a good person of not caring about human life, shame on you. Shame on you.
Do it as fast as you possibly can. That's how we're going to get change done.
Thank you.
Bonjour, Alex Villeneuve de Radio-Canada. Monsieur Holland, nombreuses maladies rares au Nouveau-Brunswick et dans les maritimes sont reliées à des syndromes neurologiques dont on ne sait pas exactement la provenance. Et il y a eu des enquêtes récemment. Mais j'aimerais savoir, est-ce que l'Agence de santé publique, Santé Canada, reconnaît qu'il y a plus de problèmes neurologiques mystérieux au Nouveau-Brunswick et dans les maritimes? Et j'aimerais savoir pourquoi est-ce que l'Agence de la santé publique fédérale ne mène pas un rôle de leadership plus actif pour mener cette enquête-là à l'ensemble des maritimes?
Oui, c'est une bonne question et certainement, c'est le cas qu'il y a des conditions neurologicales mystérieuses et là, et c'est plus présent dans la région maritime. Et pour nous, c'est essentiel de travailler ensemble et nous sommes nous sommes prêts d'agir et il y a une bonne conversation avec mon homologue, avec John, sur ces questions-là. Et on va travailler ensemble avec notre agence. Et alors, c'est vraiment un cas de coopération et ça, c'est essentiel dans cet enjeu-là.
Mr. Dornan, will you be open to leave the leadership of that neurological inquiry that you are still working on? Will you be open to leave that to the federal government? And also, in the next phase of this investigation, will you propose that environmental studies will be made to explain the neurological problem at large in New Brunswick and not the mysterious new disease, but at large environmental reason to explain the neurological disease in New Brunswick?
It's a very good question. It's not a matter of leading, it's a matter of working together. And our provincial public health agency is working very cooperatively with our federal health agency, Public Health Agency of Canada. And it's not a matter of leading or following. We are working together with our federal counterparts actively, daily. They have expertise that aids us. We have expertise that's local that aids them. And we are committed to understanding what's happening here. This affects an area of New Brunswick, but not a small number of people. And we are currently investigating each of those files with the cooperation of their primary physician, Dr. Elior Marrero. And we're hopeful that with the support that we've provided, that PHAC has provided, that our Vitalité has provided, that we'll have a better understanding what's happening in this phenomena. Thank you.
Will you do environmental studies to find an environmental explanation of all this?
Well, we have to start with our bigger investigation first to see what are, let's say, common denominators, whether it's environmental, familial, exposures. So we start there, find out what the common denominator could be first before we would look at the environment. Some of the testing that has been done on patients that are under the care of Dr. Marrero does include environmental factors. We will be looking at all that.
Okay, but the new phase of this investigation, is it more looking about the confirmation of a new disease, or is it an explanation about the number of neurological disease in general?
No, it's the first. It's a new phenomena. Whether we characterize it as a disease or a syndrome or some other common denominator, our first step is to understand what is happening before we start to link with other possibilities. Good question. Thank you.
Good morning, folks. Avery McRae, CTV News. Just wanted to ask, this was a large amount of money that was announced today in funding, and we know this is an election year at some point this year. Is this funding that was announced today guaranteed to stay in place if another party is elected into power come this time next year?
So when we sign an agreement, it's up to a government whether it's going to keep honoring the commitments. So, certainly from our perspective, absolutely. This was part of a broader strategy and funding that was announced a while ago, and I really have to commend John and his government. They've been working. They're a very new government, but they really wanted to get this done, and we're having very positive conversations about pharmacare as well. From my perspective, we're getting everything done as quickly as we can. But look, let's be clear. Pierre Poilievre has said that he is going to cut pharmacare. They voted against dental care. And I'm very concerned. They're talking about a lot of cuts. And so, he's kind of in a situation now, nobody's asked him a lot of questions. He's saying, I'm going to cut everything, but I'm not going to tell you what it is. So I'm going to save the government all kinds of money. Let me just talk for a second about health and how dangerous this is. Me.
Who at PHAC? Who's going to lose their job over this?
Nobody.
Nobody. So there is an act of treason, and of course treason is defined in the Criminal Code of Canada as the sharing of military or scientific information
Who are you
with an
accusing of
agent of a
treason?
foreign state.
Who are you accusing of
Listen,
treason?
I'm not here for you to ask
If you're
me
going to
questions.
accuse somebody of
You are
treason,
here
you're
to answer
absolutely
my
going to answer
questions,
for it.
Minister,
Who are you
and
accusing
your
of treason,
crazy
sir?
bombast and
Who
your
are you
foolish,
accusing?
petulant
Who
behavior
are you
is
accusing of
not
treason?
going to make this committee bow down
You can't
to
accuse
your
somebody of
ridiculousness.
treason and not name them.
So
That's
I think
totally
that I'm here to
irresponsible.
ask the questions,
Minister?
and you're here to answer them, which you continue to refuse to do. So this is actually a point of privilege if you don't want to answer the questions. Is that how you want to do this?
What I want to be able to do is understand who you just accused of treason, sir. That's an incredibly awful accusation.
Do you know what the definition of treason is?
Who are you accusing of treason?
No, I'm asking questions. Do you know what the definition
I get to
of
ask
treason
questions.
is?
You don't get to dictate that.
Do you know
Who are
what
you
the-
accusing
do you know
of
what the
treason, sir?
definition of treason
Who
is,
are
yes
you
or no?
accusing of treason?
Oh, you really have no idea.
Who are you
That's
accusing of
exactly
treason?
what Canadians want to hear.
Who are you accusing
What's
of
the
treason?
definition of treason,
If you
Minister?
are going to accuse somebody of treason in this country, that is a reprehensible
You know
thing to
what?
do,
I
and
do
I
not-
would ask
I
that
do-
you
I
name
do
who
not
you were
need to
accusing
answer
of
your
treason.
questions, but you need to answer mine. What is the definition of treason? Do you have any idea?
Well, I'd be curious. You name somebody as being treasonous, so who are they, and what's
I
your
asked you what the
definition?
definition of treason is. Do you know what it is?
Betraying your country.
No, that's not it. It is actually very simply knowingly communicating military or scientific information or documents to an agent of a state other than Canada with the intention of jeopardizing the safety or defense of Canada.
So
Did that happen at this lab?
in neither you nor I are a lawyer, but you and I would both know that calling somebody something like a
You know what, Minister? You're not a doctor, but
committing
you
to-
made a whole bunch of claims today that are
committing,
non-scientific
but naming
as
somebody,
well.
saying that somebody is a traitor, okay,
I'm
is
simply asking you the
is
question.
a very serious accusation, and I would say that it's normally a matter that would be determined by courts.
Yeah.
And
But
so
you
I'm
don't even-
asking,
you
I had
don't even
asked
know
you
what the
who you would.
definition is, Minister. You have no idea. You're clueless.
Well,
You
that's
have
your
no idea what the
characterization, and
answer is.
I don't know that. I
You're
think you felt that.
reckless, you're permissive,
But sir, you felt that
you
way
were loose
before you
with the
met me.
facts.
You're so blinded by your partisanship, you would have thought that about me before you even spoke to me.
No, you've proven it today that you don't
Chair,
know
point
the
of
facts
order,
of your
Chair.
file. That's the worst part.
Point of
Well, I
order,
don't know what the
Mr.
purpose
Nexby.
is. No
Excuse
idea.
me, excuse
Let's take primary care, or let's take a patient getting their drugs. You know, contraceptives in BC in its first year saved more money than it cost to give people free contraceptives. Because when you get people the medicine they need and the care they need, they don't get sicker. So I don't doubt that if you make the cuts that he wants to make, that you would save money in year 1 and year 2. But don't we need governments that are thinking 10, 20, 30 years in the future in the kind of country that we're going to have? And so I would say I will come with the full force of my being into that next election to make sure health is on the table, because it is, you know, frankly speaking, dumb to cut from health. We need to get into a position where we're upstream and we're making investments in prevention. We need to move from a system that's based on waiting for people to get sick and then paying obscene amounts of money to treat them, to a system that focuses on prevention. We need to move from a system that's focused on sort of hospitals and waiting for those, to being in the community and to places like here to get people into their homes and living full and productive lives. We need a system that is analog to be made digital. And those are going to require investments, yes. And it's easy to say cut them. But what's the consequence of cutting them? How much is it going to cost? Not just in terms of health outcomes. How much is it going to cost this country in a country that's getting progressively sicker as those cuts get made?
Mr. Doran, I had another question for you, unrelated, just on an announcement that came out yesterday from Horizon Health Network. I just wanted to get your thoughts quickly on a new virtual care model that has been unveiled for the Sussex emergency room as well as the Charlotte County emergency room. Just your thoughts on this new model that was unveiled yesterday.
We have had difficulties in some of our emergency departments maintaining staff, physicians and nurses, 24/7. And so the new virtual plan that many have already heard on the news is Teledoc, where the center is open, doors are not closed. There's competent, qualified, educated nurses and other healthcare providers, respiratory therapists working there. But oftentimes you need the help or the opinion of a physician. And so these centers are able to call a physician that could be anywhere in the country. They have video access to those patients. They interpret the results, and most patients are able to be treated adequately and go home. But there's a safety check here. If the team needs somebody on site urgently or emergently, there is somebody in this community who will come into the hospital. That's part of the understanding. So I think this is a way of keeping some of our smaller centers open, providing excellence in care, using team members that might not be on site, and respecting the ability of the team members that are on site. I'm very pleased.
Hi, Andrew Waugh, Telegraph Journal. I'd like to know, does funding for these 4 drugs already exist in other provinces? Or is this New Brunswick first? Because if it does exist in other provinces, why are we waiting to do this now?
So yeah, this is the 5th announcement. So